Hello and welcome back to the health series. This is episode number 3 and today I'm talking to you about the female life cycle. Random, I know. But what I wanted to tell you all is a little bit about each different phase of your life and how they all link together in terms of disease, progression, health problems, things like that. So I get a lot of questions from women that are going through menopause asking me why I'm asking them things about pregnancy and their adolescent period. But once you know things interlink, you can sort of pick up on things that might be happening and why they're happening. So while you watch this video today, I want you to think about where are you in this life cycle and how have you done things previously that might have affected where you are now. Or if you're a mother and you have a daughter, how can you possibly help her so that when she goes through the different phases of her life cycle, her health is at its optimum and that you can prevent future problems that are going to create havoc later on in her life. The 3 different phases of your lifestyle that are the most prominent for females is number 1, the adolescent period. Number 2 is pregnancy and number 3 is menopause. First of all, we're going to talk about adolescence, the old teenage going through puberty, which was terrible and I don't want to even think about mine. But let's talk about the health parts. There's the 2 biggest things that happen during that time that are really important for your health. Number 1, obviously you start to get your period or menstruation. This is where we start to increase our level of estrogen within our body. It affects other different aspects of our health. It has a cardiac protective mechanism. It helps our bone mineral density. It also affects our fertility and also our muscular mass. So you can see how it's quite important. The second part that's also quite important that happens during this time is we start to develop our peak bone mineral density. So for those of you who have no idea what peak bone mineral density is, it is very highly linked with how dense your bones are. So think about if they're not dense, they're brittle, right? Which means they break easily. So there's a disease called osteoporosis, basically when your bones are really, really brittle and they break easy. So we develop our peak bone mineral density from the time you get our period to about 30, which is where we reach our maximum. What you can do during this time can affect how much bone mineral density that you actually develop. Estrogen has a really, really, really important role in regenerating bone. So that's why you start to get your period and boom, you can start affecting your bone mineral density straight away. It is affected by our nutrition. It is also affected by what we do in terms of physical activity, if we do any, and how much we load up our tissues, because once you load your tissues, it puts a little bit of stress on your bone and your bone thinks, I need to regenerate some more of this because I'm not strong enough. That's how you get more bone. And it's also affected by, obviously, your period because that's affected by estrogen. So you can see how that's all linked together. Those are 2 really important health factors that we need to consider at this point in time. 2 biggest problems in our society at this point in time that are affecting those 2 components of our health. One is called the female athlete triad. This is a combination between overexpending on energy or being in an energy deficit. So that's either through exercising or through eating problems. We also have the issue of irregular periods or amenorrhea, which is when you don't actually get your period for, I think it's 3 months. Sorry, there's a truck driving past my window. So annoying. And then the third part of the athlete triad is the bone loss that you get because of all of this. So that is a really prominent problem with children who are elite athletes, or adolescents that are in elite athletic sports, or they need to be on weight restrictions due to those types of sports, or girls and females that have, females that have any sort of eating disorder, health disorder, body image issues are also going to be affected by that due to the low amount of body fat, low energy intake, you lose your period, so on and so forth. Becomes an athlete triad. That's number 1 that's going to affect your future health. Number 2 that are affecting a lot of children today is obesity and the overweight nature of our society. Let's look at the overweight factor. Overweight factor is a really prominent factor that contributes to things like polycystic ovarian syndrome, which is another female related chronic health disease. It can also impact our abilities later on during pregnancy. There's this condition, let's call it that, called gestational diabetes, which is diabetes that's brought on by pregnancy, but also overweight lifestyle during your childhood can just be type 2 diabetes as well, also impacting that time at which we fall pregnant, causing gestational diabetes. So those 2 things are probably the biggest female related issues. The overweight nature also impacts our future health in terms of cardiac problems, so whether you have heart disease, hypertension issues, there's dyslipidemia, which is cholesterol problems. Then we look at things like general diabetes, type 2 diabetes, and we also look at thyroid problems. So you can see how your health as a child or as a female adolescent is actually going to impact a lot of your future in terms of being a female and just being a human. In terms of health as well. Let's talk about the next phase of the lifestyle, which is pregnancy. In this section, I want to talk about prenatal and pregnancy as like one, because I don't know why, I just am. So let's talk about the issue that's predominantly in society is fertility. There are huge amounts of infertility at the moment. Well, there probably always has been, but social media and technology has made it even more prominent. So in terms of fertility, there are 3 real problems with lifestyle. So number 1 is that people or ladies, females, I keep calling it like so many different names, females are falling pregnant a little bit later on in life, which is obviously age related. 2 is that our life, most of our lifestyle is leading to a lot of obesity, which is also a problem when it comes to fertility. And the 3rd thing is that we're getting a lot of prominent issues with metabolic abnormalities. So that's things like PCOS, you've got insulin resistance there's diabetes, also have things like thyroid dysfunction as well. So they are all related to fertility and also what we're doing within our life. PCOS. I have so many females that message me or talk to me about the fact that they have PCOS and that they're worried that they can't fall pregnant. So what is PCOS is an increase in androgens that we have. So that's like the male testosterone on the ovaries. There's these whole research about cysts and things and what they're doing, but mostly the problem relates down to the increase in androgens and also an increase in insulin floating around, which is also known to not help with fertility as well. We also have a little bit of inflammation floating around based on the fact that it's an inflammatory problem. And all of this technically reduces our ability to ovulate and then thus fall pregnant. Because we have increased levels of androgens and we also have increased levels of insulin, what we're going to do with exercise is basically target the... It's my notebook. Forgot it was in my hand. What we're going to do is basically target the insulin resistance part of PCOS, because this is the part that we can actually impact with exercise. There is a little bit of research as to whether we can do anything with the androgens, but there's nothing that's definite as yet. However, the insulin resistance, the part that probably makes you gain weight during the PCOS, which a lot of the women are a bit obviously not comfortable with, but often more than not, an overweight body, regardless of PCOS, can also struggle to fall pregnant. So the fact that we're doing a weight management protocol can help with that whole fertility issue that someone that with PCOS might be having. So the other major concern that we have during this time of your life, or during pregnancy mostly, is the increased risk that some women have for gestational diabetes. So pregnancy is a huge energy generating period of your life. Like, you are basically building a human inside of you. You need a lot of energy. So it's a natural diabetic state that your body is going through. So sometimes it can actually exacerbate into the mum falling into a category of gestational diabetes. What are the concerns of this? Why is it a problem? So it is a problem for both mum and bub. Bad. In the short term or during pregnancy, mum is at risk of developing preeclampsia, which is high blood pressure. And this is normally a problem towards the end of your pregnancy. However, this is actually... high blood pressure doesn't really seem like a problem, but it's going to cause you all these other problems later, especially with your liver or organs, all that type of issues later on. If nothing is done about it, it's a problem. And then it also affects the bub as well. However, the old gestational diabetes also affects the bub. There is a lot of research around that says if the mum has gestational diabetes, then the baby itself is at risk of what we call macrosomia, which means it's larger for its gestational age than it should be. And then this puts them at risk for future health problems. So that's the short-term issues. The long-term issues is that the mum is now at risk of type 2 diabetes after pregnancy. So even though you might not have had it before, you get gestational diabetes, then you're at risk of type 2 diabetes then, and you're also then at risk of reoccurring gestational diabetes in other pregnancies. So then at risk, obviously, at preeclampsia of the next pregnancy and so on and so forth. Believe it or not, but the baby is also now at risk of future health problems like type 2 diabetes, also being gestational diabetic when she falls pregnant, if it's a female. And it's also at risk of cardiac health problems later on at life, and weight problems. So what you do in your pregnancy is affecting your baby's health future when it's old, if that makes any sense. So how you can see how this life cycle starts to affect and link in with each phase of your life, and what your mum did affected you, and what you're doing is affecting your baby. So what do we do with pregnancy and exercise? What do we do with exercise during this time of our life? Exercise is going to help you reduce your risk of gestational diabetes. So there's much more research based on prior to pregnancy or prenatal that you're doing exercise during that period is going to reduce your risk even more of getting gestational diabetes during your pregnancy. Obviously, if you are fallen pregnant and you start doing something, it's better than nothing. However, preparing this and exercising before you fall pregnant is going to reduce your risk even more. Exercise is also going to help with fertility issues that are related to insulin resistance and weight gain. So obviously we can affect that. Like I said earlier, we can't change, or well, there's research about it, but can't affect too much your fertility itself with your estrogen and androgen levels. However, the insulin resistance and the weight we can. We're also going to be able to combat a lot of structural changes that happen during pregnancy. So your posture shifts, you have all of these laxity throughout your joints and ligaments. Any mum that has had, if you call them a mum, they've had a baby. Any lady or female that's had children is going to tell you that during the pregnancy your body changes a lot. So exercise, we can actually help manage any complications that might be going on posturally, aches and pains, things like that. And we can also exercise so that we can actually manage to get through labor. Believe it or not, I don't know anyone that's run a marathon before without actually training for it. So pregnancy is the training period and birthing and labor is the marathon. So think about it like that. You need to train for that. There's a lot of pushing. There's a lot of, I don't know, I haven't actually had I haven't actually had a child, but from what I know, it's like a lot of puffing and panting, a lot of pushing, and it doesn't seem very easy. So the exercise prescription part can also help with that. So let's move on to the postpartum period. For one thing I'd like to say is that I refer to nearly every single one of my ladies as postnatal, even when they're 60, because once you're postnatal, you're always postnatal. So things that happen during your pregnancy and after don't just resolve themselves if there's complications in terms of like posture changes or tearing issues, core work, everything that happens during that time needs to sort of be rehabilitated. And if you don't do it, it can actually stem later on into your life and cause you more havoc. And at that time later on, you're like, why do I have these problems? Like, didn't even do anything wrong. But it's actually related to something that you went through 20, 40 years ago. So in terms of the physical problems, we have things like abdominal separation, which is separation of the linea alba between your rectus abdominis or your six-pack, which then can create problems later on like back pain. We have pelvic floor problems or incontinence issues. There's also a lot of posture changes that are going to cause you issues such as low back pain. You might have neck and shoulder pain related to the fact that you're carrying a baby and you're breastfeeding and you're like this the whole time. Pretty much a desk job, but only one-sided. So those things we can help with exercise. Also remember the emotional demands that you have been through. You've carried a little baby, you've given birth, your lifestyle has changed. There's postnatal depression is actually quite a problem. So exercise can also help with emotional barriers that you're going through. What we do during this postnatal period and how much we do is really, really important. So you could be doing everything that you possibly can to fix your problems, but if you're doing it wrong or you're doing too much, then you're going to cause more problems. Or if you're not doing enough, that's also not going to help either. So prescribing the right type of exercise in this little prime area of your life is really important for your future health, any future pregnancies that you plan on going through, and even just fixing up problems that you have at the time. So prime example is abdominal separation. Everyone gets told, oh, you got to do your core work. So everyone goes and does 1,000 crunches every single day in the gym, and this is actually the opposite of what you should be doing in terms of core work. So if you have any sort of abdominal separation, please stop doing crunches, number one, and come and see me. But you can see how it's really important to know what you need to do and not just assume that things are right for you. I'd also like to reiterate that the fact that women want to get straight back into the gym and do exactly what they did before, but even more, because they want to return to their body, which it's never going to go back that way and be exactly the same because you've gone through 9 months of hormonal changes. Those 9 months of hormonal changes hang around a lot longer than when the baby pops out. If you're still breastfeeding, your hormone levels are still affected. So you've got to give yourself time to get back there. And I'm not talking a couple of months, I'm talking like a year. Things are still lingering, things have still changed, hormones are still elevated. It's very normal. So please don't rush back into going back to that level of intensity that you did before. There is no need for it. We can get back there. You just need to take it a bit slower. Last of all, we're talking about menopause. So many women tell me that they hate it, which is, I'm assuming is right. There's people watching me through my window. Awkward. I'm gonna hide behind the wall. I don't know how YouTubers do this and not feel embarrassed. Okay, she's gone. So awkward. Let's get back to menopause. The biggest problem in menopause is your drop of estrogen. So like I said, back when we were going through our periods, we're increasing our estrogen, and that's where we can change our bone density. Now we're reducing our estrogen, so now our bone mineral density is dropping awkward, even more, and this is a problem. You probably don't understand why this is a problem because it's your bones. Like, why does it matter? Well, osteoporosis is the diagnosed condition of low bone mineral density. Itself isn't going to really cause you that many problems just hanging around, right? It's not that bad. But when you fall over, you're at a really high risk of fracture. So has anyone, if you've got a grandma or a mum and they've had or been in hospital for a fall, and then you've noticed after that their ability to do anything independently is really low, it's because they've fractured their leg. The healing process and the strength gain and the muscle work and the rehabilitation after that is actually so hard, can almost push you back into this level of being really, really dependent on other people. So as you can see, looking after your bone health is more about preventing risk of fractures later on in your life. So going back to the importance of estrogen, if it's dropping, it's going to affect your bone density. It's going to affect your muscle mass, because we talked earlier about how it increases your muscle mass when you're going through your period or you're going through adolescent phase. You've got that cardiac protective effect that you no longer have, so you're more at risk of cardiac disease. And it's also going to impact your ability to store fat around your viscera, which is your organs. So you're going to have that menopausal feel like you're gaining weight around your midsection. That's because you've got no more estrogen. Well, no, you have estrogen, it's just not as good as it used to be, or it's not as much as it used to be. So you can see how that estrogen effect that you're naturally dropping and you can't do anything really about is affecting all those other health markers. So lots of ladies will go on hormone replacement therapy, which will slow the decline of all of that stuff. So it's often great, but there are problems with hormone replacement therapy for some women. They can't have it. So sometimes, or actually all the time, you should probably be doing exercise. So if someone is going through menopause and they've come to me and they've said, oh, I've got osteopenia, which is at risk of osteoporosis, the little stage before, or I have osteoporosis, normally I'm going to screen them and say, hey, what happened to you during your adolescent era? Did you go through the female athlete triad? Because if you lost a lot of bone or you didn't get as much bone mineral density back then when you've started to lose it as you've gone through menopause, you've lost what everyone else is the same sort of amount, except because you didn't have as much to begin with, you've actually ducked down below what is a normal threshold limit for osteoporosis, and you've fallen into that unhealthy bone mineral density. So you can see what you did in your childhood has now affected you through the rest of your female life, and that could be the reason why you're actually suffering from osteoporosis. I also talk to them about, right, you might not have had the female athlete triad, you might not have had issues like that serious, but you might not have done any physical activity ever up until now. So you haven't loaded your bones, you haven't created an environment for your body to want to regenerate more bone. So you've had pretty low levels to start with, and now we're kind of working with the bare minimum. So as you can see, it's really important that we look after our bone health early on in our life. So if you're at menopause now and you haven't done that, then don't worry, it's too late, but you can still start helping to slow the decline. So a lot of the ladies that come to any of the classes that I run or any of the one-on-ones that I run will be doing bone loading exercise in order to prevent it from declining even further. However, if you have children or you have younger friends maybe, you can advise them, highly important that they do bone loading exercises during that adolescent phase and during the rest of their life in order to maintain as much bone mineral density as they can, so they're not at risk of osteoporosis later on in life. Then we want to look at what exercise can actually do for our health at the age of, or at the period of phase of your life going through menopause. So one, it's going to help load the bones and slow the decline of the bone density. We're also going to slow the decline of our muscle mass, which is really important for keeping us up nice and tall and being able to function daily. So walking upstairs, carrying shopping, getting up off a chair, that's, if you're losing muscle mass, you're going to lose your ability to be able to do that as well. We also look at how we can maintain or redistribute the fat around our viscera. We're looking at getting, obviously, rid of this menopausal gut, I'm just going to call it that, or actually preventing any weight gain at all. And hopefully just generally looking after your mental health as well, because everyone gets a little bit scared when they go through menopause and they're like, I'm getting old, I'm going to fall, and all these illnesses and things aren't working anymore. So exercise is going to help with a lot of things during that period of your life as well. So let's just go through a little recap here. You've got adolescence, you've got pregnancy, and you've got menopause, all linked in with female hormones, all affecting each other. And it's really important that you do the right things at the right point in time. So see an EP if you need some help, call me. If you could sign up to my social media, that would be great. And if you could like, subscribe, and share, I would really, really, really appreciate it. I want to reach out to as many people as I can. So stay tuned for some more videos. Otherwise, thanks for listening, and bye.